Today's episode will focus on a 38-year-old female patient presenting with a range of symptoms that are not immediately obvious, but may provide valuable insights into her reproductive and overall health. Let's jump right into that case. Case study introduction. Let's learn a little bit more about this patient. And for purposes of privacy, of course, we're using a pseudonym. Her name is Jessica. Her age is 38 years old. Her occupation is a school teacher. Pertinent medical history includes non-smoker status, no chronic conditions, routine gynecological exams, no surgeries. Her presenting symptoms include irregular menstrual cycles over the past 6 months, increased fatigue, difficulty concentrating, mild weight gain about 7 to 10 pounds over the course of that last 6 months, occasional pelvic discomfort, low libido, recent mild mood changes, and explaining that she's feeling a little bit down and stressed. Step 1. Taking a comprehensive history. As nurse practitioners, we know that a detailed history is key to unraveling complex cases. Jessica's symptoms of irregular periods, fatigue, and mood changes immediately point us toward a few potential areas to explore further. Some questions you may want to ask Jessica as her nurse practitioner would be: 1. Her menstrual history. How irregular are your cycles? Are they longer, shorter, or skipping entirely? Have you experienced any changes in your menstrual flow? Heavier or lighter than usual? Fatigue and mood. Can you describe the fatigue? Does it improve with rest, or is it more persistent throughout the day? Have there been any significant life stressors lately, or any changes in your sleep patterns? Are you feeling more irritable or anxious? Any past history of mood disorders such as depression or anxiety? Number 3, pelvic pain. Can you describe the pelvic discomfort? Is it localized or does it radiate? When does it start? Does it occur with intercourse? Number 4, libido. When did you first notice a decrease in your sex drive? Are there any other physical changes like vaginal dryness or pain during intercourse? Comprehensive history can ultimately make or break your diagnosis. So it's really important, guys, that you pay attention to what the patient has to say and make sure you're asking the key questions. Step 2, differential diagnosis. Given Jessica's symptoms, there are several potential diagnoses to consider. As nurse practitioners, it's essential to consider all possibilities and then narrow down those possibilities based on the history and clinical examination. The first potential differential diagnosis is polycystic ovarian PCOS. Why are we considering PCOS? PCOS is one of the most common causes of irregular menstruation in women of reproductive age. It can also cause fatigue, weight gain, and low libido, as well as symptoms of androgen excess like acne or facial hair growth. The next steps to consider are a thorough exam, including assessment of her BMI, signs of hirsutism, and ovarian palpation. Blood work to rule out PCOS may include testosterone, FSH, LH, and a pelvic ultrasound, preferably transvaginal, to assess the ovarian appearance for multiple cysts. The second differential diagnosis we want to consider is hypothyroidism. Why are we considering hypothyroidism? This is a women's health study, right? Well, fatigue, weight gain, irregular periods, and mood changes are classic symptoms of hypothyroidism. It's significant to assess for other signs like dry skin, hair thinning, and cold intolerance. When considering this diagnosis, your next steps would be to order thyroid function tests like a TSH, free T4, free T3, all of which can evaluate her thyroid function. Third differential diagnosis would be perimenopause. Why perimenopause? At 38, Jessica is approaching the age when perimenopausal symptoms may begin. Did you know that perimenopausal symptoms may begin up to 10 years prior to the onset of menopause? Remember, guys, menopause is that 12 months without a cycle. So at 38, it is very possible that she's in that perimenopausal stage. Irregular cycles, fatigue, mood changes, and weight gain can all be part of this transition. So your next steps in ruling out a diagnosis of perimenopause would be to assess for other signs of perimenopause, including hot flashes, night sweats, or vaginal dryness. Hormone testing can be useful, but it's not always necessary in the early stages, given that when you're in perimenopause, testing hormone could be just a snapshot. It may not represent clinically what the patient's going through. The fourth differential diagnosis would be depression or anxiety. So why depression and anxiety? while mood changes, fatigue, and difficulty concentrating could indicate an underlying mood disorder. This should be especially considered if she mentions stressors or emotional factors that are contributing to her symptoms. Your next steps when considering a diagnosis of depression or anxiety would be to administer the PHQ-9 or GAD-7. You also want to assess her coping mechanisms and stress levels. Step 3 in our clinical case study for today would be the physical exam. A thorough physical exam can help narrow down the differential diagnosis further. Here are a few key points to examine. Her general appearance. You're going to look for signs of depression or anxiety, such as poor grooming or psychomotor slowing. Vital signs. Measure her blood pressure, heart rate, and temperature. For example, hypothyroidism can cause bradycardia. Abdominal and pelvic exam. Palpate for tenderness or masses. Check for any signs of ovarian enlargement or tenderness that might suggest PCOS or ovarian cyst. Skin and hair. Look for signs of androgen excess like hirsutism or acne, which could indicate PCOS or other endocrine imbalances. Thyroid exam. Palpate the thyroid gland for enlargement or nodules. Step 4, once you've completed the physical exam, is your diagnostic workup. After the physical exam and history, you're going to want to order relevant tests to confirm or rule out potential diagnoses. So we're going to go through the potential diagnoses and kind of just review what you may want to order. Remember, it's critical of the nurse practitioner to narrow in on what you want to order versus ordering everything under the sun. So that's where your SNP comes in, your physical exam comes in. So for PCOS, you're going to want to order a pelvic or transvaginal ultrasound to look for ovarian cysts or premature follicles that are often referred to as a, quote, string of pearls. Hormonal testing would include LH, FSH, testosterone, and DHEA sulfate. For a potential diagnosis of hypothyroidism, you're going to want to order a TSH to look for elevated levels that may suggest hypothyroidism. A free T4 and free T3 can further assess thyroid function. For a perimenopausal diagnosis, hormone levels like FSH and estradiol levels can help evaluate where the patient is in her hormonal journey, as well as potentially an ovarian reserve level called the AMH. For depression and anxiety, you're going to want to administer the PHQ-9 or GAD-7 to assess the severity of the mood symptoms and consider screening for underlying stressors or past psychiatric history. Step 5, diagnosis and plan. So now that we've kind of given a broad explanation of what's going on, let's go back to specifically Jessica in this story. After gathering all of the necessary data, let's say the patient's results come back showing the following. Elevated TSH indicative of hypothyroidism, no cyst on pelvic ultrasound, a negative score for depression on the PHQ-9. So with these results, you can conclude that the patient most likely has primary hypothyroidism. So what's your management plan? Well, for medications, you can go ahead and initiate a thyroid replacement therapy like levothyroxine, incorporate lifestyle adjustments, recommend moderate exercise to address her weight gain and improve energy levels. You're definitely going to want to follow up with rechecking that TSH in 6 weeks to ensure that her dosing is appropriate. Referral is important if her symptoms persist or worsen, especially if you're a women's health provider. I know a lot of those specialists, they're going to want to refer to an endocrinologist or a primary care provider for further management and evaluation. It really just depends on what work environment you're in. In this case, the diagnosis of hypothyroidism was confirmed after a thorough assessment of Jessica's symptoms and lab results. As nurse practitioners, we must always consider the full range of possible diagnoses and use our clinical reasoning and diagnostic tools to ensure we are providing the best care for our patients. Remember that in women's health, a thorough history, physical exam, and appropriate testing can go a long way in uncovering the root cause of seemingly common symptoms like fatigue, irregular periods, and mood changes. All right, guys, that wraps up today's case study. I hope you found this helpful in sharpening your clinical skills. Be sure to join us next time as we dive into more clinical cases and practical advice for nurse practitioners.